Influence. Now, this is the third principle in the voice framework, and influence asks an important question. How does a nursing concern become an organized action that can actually change a decision? Imagine nurses on a unit repeatedly reporting unsafe staffing levels. They describe missed care, delayed medications, frequent overtime, and assignments that do not reflect patient acuity. The concern is real. The nurses are speaking, but the staffing plan does not change. And that is the distinction at the center of influence. Voice identifies the problem. Influence changes what happens next. A concern may be discussed in huddles, raised in meetings, or written in an email, but speaking about the issue does not automatically lead to a decision. So, why do valid concerns sometimes stall? The message may be inconsistent, the evidence may be scattered, the request may be unclear, or the concern may never reach the person with the authority to act. The organization hears that nurses are worried, but it may not understand exactly what decision needs to change. Influence begins when the concern becomes organized. The nurses document the pattern. They connect staffing conditions to missed care, overtime, turnover, acuity, and safety events. They involve the people who can strengthen the case, and they make one clear request. In this example, the request might be add coverage during the highest acuity hours, revise the escalation trigger when staffing falls below the agreed level, or reassess the staffing plan for the next budget cycle. The request is specific. The decision maker knows which action is being requested. And the concern must travel through the right pathway. That may be shared governance, staffing committee, nursing leadership, quality, finance, or executive review. Influence is not simply sending the message to more people. It is about making sure the concern reaches someone with the authority and accountability to act. What if no one responds? Nurses should not assume silence means the risk is resolved. They follow up, document the concern, the evidence shared, who received it, and whether action occurred. If the risk continues, they escalate to the next appropriate level. The message should remain factual, respectful, and focus on patient safety. If the concern still does not move, nurses strengthen the escalation. They bring additional evidence, involve the right partners, clarify requested action, and explain the risk of continued inaction. Then they track both concern and the response. Influence is not raising an issue once. It follows the risk until accountable actions occurs. Raising a concern is only the beginning. Influence means organizing the evidence, reaching the right decision maker, making a clear request, and following through. If the first response is silence, strengthen the case and escalate through the next appropriate pathway. Voice identifies the problem. Influence moves the systems to act. That is influence.